Imagine the following scenario. A person comes to you, a patient, with the following lesions. He has macules, he has papules, he has vesicles and pustules, all four of them at the same time, which are centripetal in arrangement. What would be your diagnosis? The answer is varicella, or in layman's term, chickenpox. Because chickenpox is the only condition, or one of the conditions, where you get all four stages, all four lesions in centripetal arrangement. That leads to a very common diagnosis of it being chickenpox. You start your treatment, you start your calamine lotion, you start antihistaminics, you start with the main antiviral drugs like acyclovir and send him off. Good, solved it. It was easy. Then you get another patient who has vesicles and rash, unilateral. Okay, now the vesicles are clear, white, with erythematous base. What would your diagnosis be? This is herpes zoster. Why? Because you have the characteristic dewdrop on rose petal appearance. You could do a transillumination test to see how clear the fluid is inside the vesicle, but okay, it's a dewdrop on rose petal type of appearance. Now, what does that mean? Rose petals are red. That gives your erythematous base. On top of that, you have a dewdrop. I can't draw with white, so this is how it appears. Erythematous base with a clear dewdrop vesicle. Easy. Both of them are easy. Again, you start with your antiviral drugs, calamine lotion and all. Send them off. In case of neuralgic pain, you prescribe diclofenac. Now, the problem is these lesions which we saw, the vesicles, the rash, the pustules, are part of the eruptive stage. Okay, eruptive stage is when the skin lesions erupt. In case of either let it be varicella zoster or herpes zoster. But in the pre-eruptive stage, okay, which lasts for about 3 days, there is nothing but cold. So you'll have all the symptoms of cold. You'll have headache, you'll have reddening of eyes, you'll have fever. It's all the same. Okay, you have all the symptoms of cold. You have fever, you have malaise, weakness and all that. And then the eruptive stage starts approximately after 3 days in some cases. And now you see the rash. But without the rash, let's say in herpes zoster and varicella zoster, without the rash, there is the absence of the rash. So rash has not yet started yet, but there will be one thing that herpes is known for, that is neuralgic pain. So you have a pain. Now this pain can mimic anything. It can mimic anything. It can stimulate any nerve. For example, it can stimulate T10. This will be pain at the umbilicus. What would you diagnose this as? You can either diagnose this as something that has to do with a disorder of the GIT. So let's say hyperacidity. You send that guy with antacids. Or this might lead you to a differential diagnosis of appendicitis, acute appendicitis. You give that boy antibiotics and you send him for an ultrasound. Imagine it stimulates T6. That comes within the chest region. Now again, you'll have to differential diagnosis between if it is a lung disease or if it is a heart disease. You send the person for an ECG. Okay, you send the person, or if it's a lung, you send him for a chest x-ray or an ultrasound. Again, but it has nothing to do with what we are differential diagnosing it about. It is just a nerve pain that has started, and it's mimicking because that nerve has been infected by the virus. Okay, so again, if it's T6, you might think again something to do with breast also, because breast also comes here. And if it's as infected T12, then you have to suspect the pubic area. Okay, then if it's sacral some of the sacral segments involved, then you think it's the heel. If it's C3 which is involved, then shoulder. So on pain of the shoulder, you might think that something is wrong with the gallbladder. You send that person for a blood analysis to check for the bilirubin levels. Then you do ultrasound to check for the gallbladder condition. So again, these are all referred pains, not actually referred pains. These are neural pains, which have nothing to do with the organ at which we are thinking, but it's a pain in that region because of the stimulation of nerve, law of projection, if you might. Okay. If there were eruptive stages, the person would have been diagnosed easily, like we saw earlier. But now, since there is absence of eruptions and we just have pain, we are left in the dark. Okay. So either, I'm not saying that sending the person to investigations is wrong, but it is what it is. Such things happen. It's not a failure. Such things occur commonly. So I thought this topic was interesting. I just wanted to put it out. Hope you guys also found it interesting. Like if you like the video. I'll see you in my next one. Thank you for watching.